As an overachieving youngster, they called him a know-it-all. As he piled up honors, inventions, and achievements during his early career, he was labeled a nonconformist. And while expanding his field as a seasoned veteran, his critics dubbed him a maverick. But he never heard it. Still doesn't. You see, he's too busy to deal with detractors, too determined to become discouraged, too focused to get sidetracked. He is Dr. Ted Diethrich, a man of action. Born in Toledo, Ohio, to a strange paradox that perhaps destined him to be a heart surgeon. His father, a teacher by trade, ran a hamburger joint, and his beloved mother was an RN.
My mother was a special kind of nurse. First of all, she looked like a nurse. She had on a white uniform, and she had on her nursing cap, and had a black band, and she had her nursing pin. And you know, even today, I try to convince the nurses on the floor, well, you see it here? See these nurses, these RNs? See their caps? I mean, that's because my mother looked like a nurse, and I still say today that you should dress, if you're a professional, you should dress like a professional. And she was very much a professional, and she taught me that professionalism right from the beginning.
This career path that brought his mother so much pride did not go unheeded to Ted. As a young lad, he started taking on the persona of what he would ultimately become.
I don't remember this, but I've read stories that when I was just a toddler, that I used to take my teddy bears and open them up and pull out the cotton and put the cotton back in. And I think those are true stories because my mother told me. I had an interesting upbringing in terms of early experience and exposure to medicine because of my mother.
Ted soon graduated to hamsters, and before long, even Homo sapiens weren't safe.
We had this country doctor who used to do tonsillectomies and vasectomies on Saturday morning. And so Mom said, you know, come on over and you can wash up and scrub on these things. And he actually let me do a vasectomy, and I tell you, I did a lot of suctioning on tonsillectomies. And in those days, with open drip ether, I mean, it was really crude and bloody. So I had had a lot of experience in the operating room by the time I graduated from high school.
Sandwiched between snippings, Ted was a tireless adolescent. Football, basketball, baseball, band, and of course, straight A's, which allowed Ted to emerge from his modest upbringing in Hillsdale, Michigan, to the big campus in Ann Arbor and the University of Michigan.
So I had the band scholarship and I had an academic scholarship, but I needed extra money. And so I got a job right away at St. Joseph Hospital. And throughout my entire pre-medical school and medical school, I scrubbed in the operating rooms at St. Joe Hospital. I took call. Every night I took call. Every night I could, I would take call. And I became an expert in scrubbing, in neurosurgery, orthopedic surgery.
Again, Ted managed to squeeze in studies between call and band performances. Upon commencement, he was accepted into the UM medical program. It was during this period when Ted made his first mark on the medical world. With thoughts of brain surgeon on his cranium, he took to inventing a device that would eliminate a once brutal surgical practice.
I was a young intern, and I at that time thought about neurosurgery, and the way they were opening the skull was very crude, and so I thought maybe a better way we could do it would be to have a saw that would be like a Sears and Roebuck saber saw. And so we went down, we purchased a saber saw, Sears and Roebuck, and we put it on the bench, and we made some modifications, and we tried it in animals, and it never worked very well. And one evening, I had the idea that maybe it would be good for the breastbone on the dog, because we were doing some dog work also. And indeed, the sternum of the dog is only this wide, but we took this is the clinical modification of that saber saw, but we used it, and we split the sternum 3 times in a row on the dog. And I very excitedly that evening called the professor of thoracic surgery at the University of Michigan and said, we've got a new way to open the sternum. Because before that, we were taking what's called a Lebschi knife and a mallet, and we would just use that knife and mallet and just like a chisel going up through the sternum, very crude.
Shortly after, the Diethrich sternal saw became the favorite access tool into the heart for surgeons. And the invention put Ted on the map. A few years later, his brainchild helped land him a position training at the Mecca for heart surgery, Houston, Texas. But admittance as the first outsider ever accepted into famed surgeon Dr. Michael DeBakey's residency program would soon make Ted think twice about his career path.
First couple weeks is going just fantastic, I'm scrubbing. And then it just starts to deteriorate.
You're too slow, I can't stand that. You're too slow.
One Saturday morning, we were doing a carotid. So I go in the operating room, I drape for the carotid, wait for Dr. DeBakey to come in to make the incision. He walks in, and he tears all the drapes off and throws them on the floor. He says, haven't you learned how to drape the patient yet? And I didn't do anything wrong. I drape the patient again. He walks in, and he tears it off. The third time, he walks in, and he says, well, who's going to assist on this case today? I said, well, Dr. DeBakey, I am. He says, no. He walks out, and he goes out, and he gets Ed Garrett, his senior associate, to come in and scrub on the case. And it got worse. It got so bad. On one case, it was a mitral valve patient we're operating on. And I thought I was doing a pretty good job. He says, you don't want to help me. He said, Dr. Diethrich, you don't want to help me. Aren't you interested in this case? He said, you just don't want to help me. He said, you go over there and stand in the corner. You go stand in the corner, and maybe you can learn how we do these cases. It was terrible.
After months of humiliation, Ted was relegated to secondary tasks. While awaiting DeBakey's arrival to complete a fem-pop bypass that Ted had already exposed, Diethrich made a fateful decision. He performed the case solo.
The graft's in, and I'm standing there at attention. Dr. DeBakey walks in. He says, where are you? And I said, well, Dr. DeBakey, I put the graft in, and the x-ray's over here. He walked over, looked at the x-ray, and walked out. I said, that's it. I'm done. I'm fired. Didn't say a word to me. Did not say a word. I was sure I'd finish rounds and he was going to call Art Bell and say, get this joker out of here. So we're going down, we're going across the bridge, full speed, and all of a sudden he stops like this, and it's almost like dominoes. All these guys are, he turns to me, he said, Ted, he says, tomorrow morning, he says, you're going to start operating in room number 5. Room number 5 was the training room for the DeBakey associates. The next day, I started operating there. It was like night and day. He never, ever, ever from that time on treated me any way except like an associate. He was testing me.
Ted had passed, and his timing was impeccable. Because it was the 60s, it was Houston, and Texas heart surgeons were bigger than rock stars.
During the time that I was in Houston, a lot of exciting things were going on, development of heart-lung machines, new kinds of equipment, large volume of patients going through the Texas Medical Center. But the thing I think that really caught the attention of the people of the world was human transplantation. Well, one of the things we appreciated very early in the transplantation program was the problem of enough donors. And we had the idea that from one donor we could perhaps use multiple organs. We had developed this the concept that one phone call would trigger 5 operating rooms.
Pleasure for me to introduce to you Dr. Michael E. DeBakey.
In that one operating session, the heart, 2 kidneys, and 1 lung were successfully transplanted into 4 recipients. And although the headlines the next morning read DeBakey Team, it was Ted and colleague John Litico who meticulously orchestrated the monumental procedure.
This is not a difficult operation for any team that is experienced in cardiovascular surgery. They can...
Ted soon realized that the pecking order in Houston would long list DeBakey, Dr. Denton Cooley, and then the other docs.
2 can be as bad as 1. It's the loneliest number since the number 1.
It was time to make a break to greener, or should we say, well, perhaps greener is the word. And the Arizona Heart Institute was born. Home of the first outpatient heart clinic, first outpatient cath lab, where the first nationally televised health survey was broadcast, followed by the first live worldwide telecast of an open heart surgery. Many questioned what a heart surgeon of all specialties was doing, advocating a philosophy of prevention and early diagnosis. But it is well known that restlessness is the torment of the most steadfast soul. And Ted Diethrich never could stay put. He wanted to be where the action was. So, as the late 1980s approached, he decided to once again reinvent himself.
I think if you look at surgery today, you're seeing that there's a movement from invasive techniques to less invasive techniques. It would just seem impossible that this less invasive movement wouldn't also spread to the heart and to the vascular system. And as I saw this moving maybe 10 years ago or longer, I decided that as an institution we need to become involved in what we now call endovascular surgery. We didn't have that term at the time, but involved in working within the artery rather than around the artery, clamping and cutting and sewing, instead maybe working from within. And that's why I have been so interested in, some people say championed, what now is a movement that we call endovascular surgery.
Ted helped usher in the introduction, elimination, and then reintroduction of laser therapies to treat heart and blood vessel ailments. He popularized the method of stenting anatomy that others were more reluctant to investigate. He advocated the endograft movement, and today, Ted has accepted the onus of leading the charge for gene therapy and myoblast cell research. Not bad for a kid from Hillsdale. A young man who overcame the ultimate mentor test, who took the heat to lead his field into the future, and surely made a mother proud. Tonight, we honor Dr. Ted Diethrich, renowned cardiovascular surgeon, master innovator, endovascular pioneer, world-class educator, and man of action.